If you're over 70, I want to have a very real and gentle conversation with you today. It's about something that often gets brushed under the rug, even by the most well-meaning doctors. Every year, millions of older adults like you go in for checkups, thinking they're doing the right thing. And most of the time, they are. You're trying to stay ahead of problems, take care of yourself, and be proactive. That's admirable. But what if I told you that some of those routine tests, the very ones we're told will protect us, can sometimes lead to more harm than good? You see, recent research has shown that a large number of medical tests done on older adults end up leading to more anxiety, more medications, and sometimes, painful side effects, all without actually improving health or quality of life. In fact, up to 37% of tests in seniors fall into that category. But hardly anyone talks about it openly. And that's the problem. So today, we're going to talk about 5 common medical checkups that people over 70 often get, and why they might not be as helpful as we once believed. I'm not here to scare you. I'm here to empower you, to give you the knowledge and confidence to ask the right questions the next time you're sitting in that doctor's office. Before we dive in, I'd love to know, where are you watching from today? Drop your city or state in the comments below. I always love seeing how far our community is reaching. 1. Bone density scan, when a simple test creates unnecessary fear. Let's start with one of the most commonly recommended tests for people over 70, the bone density scan, also called a DEXA scan. On the surface, it sounds harmless, right? No needles, no pain, and in just a few minutes, you walk out knowing how strong your bones are. That sounds like a good thing. But the problem is, for older adults, this test often tells a story that leads to worry, medication, and complications, without real benefits. Here's the truth: as we age, some bone loss is completely natural. Just like gray hair or wrinkles, our bones also go through changes. But the scan doesn't see it that way. It simply compares your bones to those of a 30-year-old, not someone your age. So when the results come back saying osteopenia or low bone density, it can sound like something's wrong when in reality, your bones may be perfectly fine for your stage of life. What happens next? Many people are prescribed strong medications like bisphosphonates, drugs meant to strengthen bones. But these medications come with their own risks. Some people end up with terrible acid reflux. Others develop something called jaw necrosis, where parts of the jawbone begin to die. That's a frightening and painful condition, and for many, it wasn't necessary in the first place. In fact, research shows that for people over 70 with mild bone loss, these medications have very little impact on whether you'll actually break a bone. One major study tracked over 1,200 women above 70 and found that the medication only reduced the risk of fractures by 0.3% over 5 years. That's not much. But what was significant were the side effects: stomach issues, esophagus irritation, and even brittle bones from long-term use. Instead of jumping straight to medication, there are safer, more effective ways to protect your bones. Things like gentle weight-bearing exercises, resistance bands, vitamin D, and foods rich in calcium, like sardines, leafy greens, and plain yogurt, can do far more to support your bone health without side effects. So if you're not falling, not breaking bones, and feeling steady, you may not need that scan at all. Ask your doctor, if this scan finds something, what exactly will you do next? That one question. 2. Brain MRI, when forgetfulness turns into fear. Let's talk about memory. If you've ever walked into a room and forgotten why, or struggled to remember someone's name, you're not alone. These things happen, especially as we get older. But because memory loss is such a sensitive topic, many people feel anxious and jump straight to medical scans, especially MRIs, hoping to find answers. That's where things can get complicated. A brain MRI might seem like a smart idea. It gives a clear picture of what's going on inside your head. And in some cases, yes, it's useful. But most of the time, for older adults who are just noticing some mild forgetfulness, the results of an MRI can create more worry than clarity. Here's why: MRIs are incredibly detailed. But they can't always tell the difference between harmless aging and something dangerous. So when a scan shows things like white matter changes or minor shrinkage, it sounds alarming, even though these are completely normal in people over 70. But once a doctor mentions abnormalities, it triggers fear. Suddenly, you're imagining the worst: Alzheimer's, dementia, brain disease. From there, it often spirals. More tests. Referrals to specialists. Maybe even procedures like spinal taps or biopsies. In one large study of people aged 70 to 85 with mild memory complaints, 86% had something unusual on their MRI, but only 3% had anything treatable. And sadly, 12% ended up having invasive procedures that didn't help at all. That's a lot of people going through pain, stress, and expense, for nothing. Let me tell you what's often a better first step: a simple paper-based memory screening test. It's safe, quick, and gives a good idea of whether something serious might be going on. And from there, the focus should be on lifestyle, things like better sleep, staying hydrated, reducing stress, staying socially active, and doing brain games or puzzles. These changes are powerful and often enough to make a real difference. So before jumping to an MRI, ask yourself, am I just aging normally, or is this really a medical emergency? And ask your doctor, what will we do with the results? Will it actually change anything? That simple pause can protect you from a whole chain of worry that may not be necessary. 3. Cardiac stress test: when the heart is fine but the test says otherwise. Now let's talk about a test that sounds serious just by its name: the cardiac stress test. If you've ever felt a little more tired going up the stairs or noticed your heart beating faster on a walk, your doctor might have suggested this test to check things out. And while it's meant to spot blockages in the heart, it can sometimes cause more problems than it solves, especially if you're over 70 and don't have classic heart symptoms. Here's what usually happens. You're asked to walk on a treadmill while your heart is monitored, or, if walking isn't possible, you're given a medicine to simulate exercise. The idea is to see how your heart responds under pressure. Sounds logical. But here's the catch: in older adults, these tests often give what's called a false positive, which means the test says something might be wrong when your heart is actually doing just fine. Studies show that up to 40% of stress tests in people over 70 turn out to be false alarms. And once that alarm goes off, it's hard to turn back. You may get sent for an angiogram, a procedure where a tube is threaded through your artery to look for blockages. And if anything looks even slightly abnormal, the next thing you know, you're getting a stent or even bypass surgery, all without actually needing it. And here's the tough part: these procedures are not small. They come with risks, like bleeding, kidney injury from the contrast dye, long hospital stays, and slower recovery. One large study found that more than half of the stents placed after stress test referrals were in people who didn't actually benefit from them. Their survival didn't improve. Their symptoms didn't go away. But their bodies still had to go through all the recovery. So what's a better choice? If you're not having real heart symptoms, like chest pain during activity, shortness of breath, or serious fatigue, you might not need the stress test at all. A simple resting EKG or a coronary calcium scan, a low-radiation heart scan, can often give safer and clearer answers. The key is to ask, if this test shows something, will it change what we do? Because sometimes, the chase for answers can end up creating problems that weren't even there to begin with. 4. Routine cancer screenings: when early detection isn't always the best protection. Let's talk about cancer screenings. We've all been told that early detection saves lives. And yes, in many cases, that's true. But as we get older, the conversation changes. Your body, your risks, your quality of life, all of that becomes more important than simply finding a disease early. Yet many older adults still receive cancer screening tests that may not help, and in some cases, actually do harm. Take the PSA test for prostate cancer. It's a simple blood test that looks for a marker in men. But here's what most people don't hear: nearly 75% of positive PSA results turn out to be false alarms or slow-growing cancers that would never cause harm. Still, many men end up having painful biopsies, surgeries, or radiation, all with risks like incontinence, erectile dysfunction, and infections. And for what? In men over 75, studies show that PSA screening does not reduce death rates. It just increases worry, procedures, and side effects. Now, for women, especially those over 75, mammograms can also raise questions. By this age, if you've had regular screenings before and no signs of breast cancer, the odds of developing fast-growing, dangerous cancer are low. But the chance of a false positive? Much higher. And once a suspicious spot is found, the path often leads to more tests, biopsies, and possibly surgeries, even for tiny, non-threatening abnormalities. One large study found that for women over 75, regular mammograms did not significantly improve life expectancy but did increase the number of unnecessary treatments. It's not about ignoring symptoms. If you feel a lump or something is clearly wrong, absolutely, get it checked. But when it comes to routine screenings in healthy older adults, it's time to ask deeper questions. What will this test really do for me? Will finding something small change how I live, or just make me more anxious? Doctors are now being encouraged to personalize screening decisions, not just based on age, but on your overall health, how long you're expected to live, and how well you're functioning. If a test won't help you live better or longer, maybe it's not the right test anymore. So the next time someone says, "It's time for your screening," take a breath. Ask, what will this test really mean for me, right now, at my age? Your peace of mind and well-being matter more than checking a box. 5. Bone density scans, when thinning bones don't mean fragile health. Now let's talk about something almost every older adult hears at some point: you should get your bone density checked. The test is called a DEXA scan, and it's used to measure how strong or thin your bones are, especially in your hips and spine. On the surface, it sounds like a smart idea, right? After all, no one wants a broken bone. But here's the truth that's rarely explained clearly: just because your bones are thinning doesn't mean you're in danger, or that you need strong medications right away. The DEXA scan gives you a number called a T-score. If it falls below a certain level, doctors might say you have osteopenia or osteoporosis. And when people hear the word osteoporosis, they get scared. They picture bones breaking with one small fall, or being confined to a chair. But here's what isn't often explained: bone loss is normal with age. And the numbers used to define osteoporosis are based on comparisons with healthy 30-year-olds, not with people your age. Think about that. Of course your bones aren't the same as they were at 30. That doesn't mean they're dangerously weak. Worse, many people over 70, especially women, get started on heavy medications like bisphosphonates, such as Fosamax, right after one scan result. These drugs come with risks: jaw pain, inflammation of the esophagus, bone pain, and in rare cases, even unusual fractures from long-term use. And yet, they're prescribed routinely, even when the actual risk of fracture is low. One large review found that in adults over 75 with mild to moderate bone loss, the benefits of bone drugs were often minimal, especially if the person hadn't had a fracture before. Lifestyle changes, like balance exercises, vitamin D from real food and sunlight, and avoiding sedatives or blood pressure drops that cause falls, had a bigger impact than pills. Here's a better way to think about it: if you haven't had any serious falls or fractures, and your daily life is stable, your bones may be doing just fine for your age. The scan isn't useless, but it should be one small part of a bigger conversation, not the whole story. So before you accept a scary diagnosis and start a long-term drug, ask your doctor, do I really need treatment, or is this just part of aging? Your bones are part of you, and you deserve to know the full picture.